Hey guys, welcome to this week's Facebook Live. I'm Shalini Joshi Amdagni, and this week we're looking at chronically misunderstood chronic pain. So if you are in chronic pain because of n number of reasons, right? It could be that maybe you have an illness because of which you have pain constantly, or you just have been having aches and pains for a long time and you didn't really have any illness, but it's there, or for whatever reason, or maybe you had an accident, right? And because of that, you have persistent pain. So no matter where you are with pain, I hope, I want you to stay tuned because today is all about chronic pain and how misunderstood chronic pain is. And the reason I can say that with confidence is because I've been on this journey for 12 years and I healed myself out of my chronic pain. So today we're going to be looking at, hi Brian, thank you for joining live. And whoever's joining live, please come and say hello. If you're watching on replay, welcome. And I would love to know if you are suffering from chronic pain, then what are you dealing with? I would love to know, and I can share some tips from my 12-year experience, right? So do pop in and let me know what kind of chronic pain are you dealing with right now. So meanwhile, today we're going to be looking, hi Peggy. So we're looking at the invisible illness, chronic pain, and 5 mistakes people make with, dealing with chronic pain. We're looking at, how we can think like Sherlock Holmes, right? When we are trying to deal with chronic pain. And then I'm sharing the one-stop tool for any kind of pain that you may be having. Okay. Hi, Alpana. Yay, so nice to see you. She's my college friend. Hi, Azim. Nice to have all of you here live. And so let's begin with the invisible pain. Now, I don't know about you if you've had experience with chronic pain, but I have, and I've helped thousands others who have. And when you are in chronic pain, nobody else can see what the heck is going on with you, right? Because it's an invisible illness. Like you feel it, you sense it, you are aware of it, but on the surface, I could be looking like this and in massive chronic pain. So it's an invisible illness and it's a very misunderstood illness. And so some of the things that make it so misunderstood and so complicated is, it has no objective measure. Like there's no way to know. When you go to a doctor, right, they test you, they get these readings, right, and tests, and so they have some concrete data to work with. But chronic pain, there's no way to measure it, right? It's just whatever subjectively, whatever you're feeling, and then you're trying to explain it. And then it's so hard because I've had myself and clients who say, Shalini, it's just so hard for my partner to understand what the heck I'm experiencing, and because another reason is that it varies. It's like, oh, it's here today and it's really strong today and it's shifted location today. It was on my leg, but now it's on my hip. And it's like this mystical illness that is hard to grasp, right? And what you can't see, you can't treat. So a lot of people say, I go to the doctor and he says, no, everything's fine. They do the x-rays, they do the diagnostic tests, whatever, right? But there is no way to see what the heck is going on through the x-rays in the tests. There's no abnormalities that are popping out. And so the doctor thinks, there's nothing wrong with you. You're making it up. It's in your head. And while there may be some truth to that, but it's a very real experience. Physical pain is real. Chronic pain is real. So it's really misunderstood, and it's hard to grasp, right? And also a lot of the doctors, clients who come to me have been through all the whole gamut of treatments, right? The conventional treatments, whether it's physiotherapy, ultrasound therapy, hot pack, cold pack, you know, neck support, rib support, leg support, ankle support, knee support, whatever, right? And what's fascinating for them is that the doctors, you know, are prescribing them standard chronic pain medications, and while some of the patients are getting results, a lot are not getting the results, and so you feel crippled. You know, you feel at the mercy of the doctor, and the doctor thinks there's nothing wrong with you, but you know everything is wrong, right? Your everyday life has this heaviness about it, and nobody understands that. And a lot of clients say, you know, my family thinks I'm just lazy, I'm just making excuses, I'm trying to avoid responsibilities, and so on and so forth, right? And so it looks like there's nothing wrong with you because technically you're looking fine. Like if you saw me in chronic pain, I would still be looking like this. And so it's an invisible illness, and it's very misunderstood. So, you know, I don't know what your experiences are with chronic pain, but I'm sure you can relate to some of this. And so I want to share with you 5, I'm sure there's a ton more, right? But 5 common mistakes that people who are suffering from chronic pain, the mistakes that they're making, and they don't even know that they're making these mistakes, because I was one of these people 12 years ago, right? So 5 mistakes. So the number one, the very obvious one, is that pain is the enemy. Pain is the enemy, because I was doing fine and suddenly this pain happened, and now this is the enemy because it's disturbing me, it's limiting me, it's not allowing me to do what I want to do. So, you know, it's the enemy. So that's the natural way anybody who's been, you know, with chronic pain for a while will think, and it's normal, right? But it's not the truth, right? So it looks like an unwelcome guest, like you forced yourself on me, and now I'm stuck with you, and you're the enemy. And then, of course, number 2 is then you try to get rid of it. Like, how can I get rid of this pain? Let's pop some painkillers, let's get some injections, put the balm. Like, how do I stop it? How do I stop this pain? And while that is also the natural thing to do, there is still a problem with that approach, right? On a deeper level. Then number 3 mistake is just focusing on the physical part of the pain. Like it's a shoulder pain or it's a neck pain and it's here, and putting the balm and just kind of like seeing this whole thing as a physical thing. Like something happened and this happened to me and I'm stuck with it, and it's this physical thing that's going on. And you know, while it seems like the most obvious thing, right? Because that's what you're seeing. But that's still not the absolute truth. And it's a mistake to see pain, physical pain, as only physical. As weird as the sound, physical pain is never, 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 never only physical, unless it's an acute pain, not chronic pain, right? Because acute pain is you bump against something and then you have the pain. So that is acute pain. You fall down and you have pain. That's acute pain. Chronic pain is never about just the physical, whatever is going on with you, right? And then trying the same treatments. Another big mistake that people make is, you know, they'll go and get the injections, or they go get the painkiller, or they'll go get the stronger anti-inflammatory pill, even though they don't see results, even though they're not getting the results, as I was not getting the results, right? And the doctor said, well, you have to take it for a longer time. Well, everybody is different, and for other people it takes longer. And so you live in that hope that maybe if I do it for a longer time, maybe if I take a stronger medicine, because my case is so unique, I need stronger pills, right? So you go down that path and you keep at it. Like me, I kept going to the ultrasound therapy. I kept going to the physiotherapy. I kept trying the anti-inflammatory pills over and over and over, even though my pain was getting worse and worse and worse, right? And sometimes, they'll say just bed rest. Like you have to be on bed rest indefinitely, like me. But that didn't stop the pain either, right? I wasn't working, I wasn't using my shoulders, I wasn't doing nothing, but the pain got worse. So even that is, just, yes, go ahead and lie on the bed and rest, but that's not the solution. It's not going to suddenly take away the pain, right? Sometimes it makes it worse. And then, like I was saying earlier, no personal responsibilities. Like, this happened to me, it's coming out of nowhere, I have nothing to do with this, poor me, I'm helpless. And so just, feeling powerless and hopeless. And trust me, I have been there, right? When the doctor says nothing's wrong with you, we can't figure out what's wrong with you, and try this and try this and try this and try this, and nothing's working. And you think, okay, that means I'm stuck. Poor me, helpless me, I'm at the mercy of all these people who should be trying to help me, because I don't know what to do with this physical pain. It's not mine. I did nothing, right, to create it. And so you feel helpless. So these are the 5 common mistakes, right? And what I want to say, I can go into a lot of detail because this is one of my, favorite topics to talk about, because it pains me to see, even as I go through the list of websites that are talking about chronic pain and living with chronic pain and how to stay fit with chronic pain. And you don't have to stay in chronic pain. And there are all these misconceptions and misunderstandings about chronic pain, because chronic pain is a complex thing and there is no one size fits all, right? And pain is not your friend. I was just on an interview at the Mindset Reset TV with Lisa Winston and Robert Clancy, and I was telling them pain is simply a message from your body, and it's trying to tell you something about you, not what's going on physically with you, but what's going on emotionally inside of you, right? And so people just don't want to connect or don't know that your emotions, and that you're pissed, and that you're angry, and that you're upset, and that you are feeling guilty, and that you're feeling anger is all, contributing to the pain that you are feeling. It's so, there is a physical part to it, right? But the medicines are not going to do it. The painkillers are not going to do it unless you're going to address different complex layers. And so here's the tip about think like Sherlock Holmes, right? Everybody knows the detective, the famous detective, right? Unless you've been living on another planet, you should know about Sherlock Holmes, right? Or Google it if you don't. And so don't just see the problem, observe what's going on in your life. Like, what is the pain in my life right now? What's going on? What feels painful in my life? So, your body is divine intelligence. Every cell, trillions of cells in your body, they know what to do. Your body knows how to make a baby. Your body knows how to heal itself. Your body knows, how to grow your hair, or your intestines know what to do. Your liver knows what to do. Everything in your system is so amazingly fantastic. Like, no supercomputer could ever be created to duplicate this system that we've got going. And the only thing that messes up the system is something that we're doing, not consciously, but subconsciously, right? So don't just see the problem, observe what's going on with you, with your life, in your relationships, in your job, in your creativity, like what's going on in my life that's contributing to this pain, and overcome the bias, right? That's thinking like Sherlock Holmes. Don't bring your own biases into the mix. So if you have some kind of pain, right? Like let me take my example. I had costochondritis, which was a pain somewhere around my left ribs, right? And I said, oh yeah, I know why I have this pain. I have this pain because I overdid the gym exercises. I was doing the abs exercises, and that's why I have this pain. Okay, I'll try to go fix it, right? Don't bring your own little theory about what's wrong with you. I promise you, after working with so many clients, people think they know what the cause is, but it is completely different, completely, like upside down different. Okay, so stay open to what else might be contributing to the pain, and don't dismiss anything. If I had dismissed this tool that I use to heal myself from my chronic pain that had confined me to bed rest indefinitely, I wouldn't be here today talking about it. So, don't dismiss anything that comes your way. Be open to it. Allow your instinct to guide you. And if it feels like, I want to give it a try, don't dismiss it. Go give it a try. Maybe it's a workshop you need to attend. Maybe it's a seminar in your neighborhood that's coming up, and you feel like, what if I attended this? So don't dismiss anything, okay? Don't think linear. That's another way that Sherlock Holmes is always thinking non-linear, right? And what we mean by it's like not a very logical thinking process. Like, I overdid the abs, I should have stopped, and because I overdid it, I have this pain in my left rib, and that's why I have this problem, right? That's very linear. That, the costochondritis disease that I had, it had nothing to do with abs exercises, right? It had everything to do with the struggle that I was experiencing at work. I hated my job. I was feeling frustrated. I felt like I had nothing meaningful going on in my life. I felt like my life was just drifting aimlessly, and I felt sucked out of joy. Had nothing to do with abs exercises, right? So don't think linear, like jump around. It's all over the place. That's chronic pain. It's not linear. And then don't give up, right? A lot of the times, because of all these misconceptions, because we think that the experts, the doctors don't know what to do with me, and I've tried so many things, and now nothing's working, I just have to live with it. I mean, you just have to Google about chronic pain and managing chronic pain, and you will see endless websites, blogs that are talking about how to manage pain and live with it. And it's like they accept that this is part of my life, and all kinds of false assumptions that as I grow older, I just it's going to be part of my life, and it's all crap. It is, because there is a way out. So don't give up, no matter what kind of. And then you might say, okay, Shalini, I understand what you're saying, but I had an accident, right? I had a car accident, I had a whatever accident, and that's why I have this structural problem, which is why I have the chronic pain. So over 12 years, I've worked with all those kinds of people too, who have the structural problem and multiple surgeries and all that stuff, right? The truth is that yes, you can have an accident, but you can completely release the pain, completely. I mean, if you go back to some of my videos, I was sharing about my son who had an accident. I don't know what that Facebook Live was called. There are no accidents. That was the that was alive, and my son had an accident because of which he had pain, and then we totally released it. And I had a client who had she was driving her car with her friends, and they got into an accident, and she had chronic pain and all kinds of fears about driving, and as we released and let go the different complex layers of the physical pain, the fears, the angers, the guilt, the shame, and all of that, her pain was completely gone. And I can go on and on telling you stories. So don't give up. That's the whole point. Think like Sherlock Holmes, okay? Go analyze. Don't just see the thing and make assumptions about it, okay? And so what have we got? Diagnosing shoulder pain. I don't know if I put it there, but I'm just going to talk about shoulder pain. So for example, let's say you have chronic shoulder pain. It's just something I picked up. And so if you want to say like, okay, so what are the, what is the root cause? How can I analyze the shoulder pain, right? So for example, normally you would tend to say, oh, I know why I have the shoulder pain, because I work long hours on the computer and I carry this heavy bag when I travel back and forth, and it's all this weight. It's like constantly, and my posture is not good enough, and that's why I have this chronic pain. Linear thinking, isn't it? Isn't it the normal thing that we think of? I did. And a lot of clients with frozen shoulders and all kinds of issues with the neck, shoulders, even upper back have this thing. But here's where we think like Sherlock Holmes, right? So observing your life and asking yourself, like, what do shoulders really stand for? Like, what is the function of the shoulders, right? You carry your bag there, you carry weight there, you carry responsibilities, you carry the burden, right? Usually we hang our bags like that. But the bag is not the real problem. It's what baggage are you carrying and moving forward with? What's the emotional baggage that you are shouldering? What is the weight of the responsibilities in your life that you are shouldering? Maybe it's about the kids and their studies. Welcome to my world, right? Or maybe it's the responsibilities at your office. Maybe it's become the weight of the responsibilities is weighing you down, right? So when you have shoulder pain, yes, a tiny bit is contributing, because of working long hours, but that's not the root cause. That's the linear thinking. The non-linear thinking is what's going on in my life, because your body speaks your mind. That's actually a book by Deb Shapiro. I should have written that. So your body speaks your mind, right? And whatever is going on here is manifesting somewhere in your body. That's why I said pain is not the enemy. Pain is a messenger, and it's sending you a message about what's going on with you emotionally, mentally, spiritually. So when you go back to shoulder pain, chronic shoulder pain, right, you want to ask yourself, where am I feeling overwhelmed by the weight of all the responsibilities? What baggage am I carrying with me? This invisible illness with this invisible baggage. I mean, there's so much baggage, but you don't see it, right? But it's there. It's the emotional, the mental baggage. Maybe it's about work. So you've got to think out of the box. You've got to think of all kinds of unrelated issues, but they're so related, to really diagnose what's going on at the root. A lot of the times, people say, when you have a left hand pain and a left, what do you call that? Arthritic pain, right? It's the joints, the left joint, the left elbow joint, the wrist joint, the finger joint, the leg joint. And it is an alert for heart attack, isn't it? That's what it is, the left side of the pain. And people start saying, oh, beware of the pain in your left side of the body, especially the joints, right? Because it's a sign that you might be, you know, you're vulnerable to a heart attack. And while that's true, because your body gives you signals and red alerts, the truth is, in my experience, that your heart is aching. And you know, your heart is on the left side of your body, right? And when the heart is aching, there's all this pain radiating, right? Through all the different parts of the left hand, the left whatever. So what, you know, it's the pain in the heart that is radiating out, and your body is now signaling through this pain, because you can't see the pain in your heart. It's not a physical thing. You can't measure the emotional pain you're feeling, but your body is radiating back to you what's going on with you. So yes, that signal could be about heart attack, but there is pain in the heart. So it's kind of the reverse thing, that like nobody's going to look at that pain that way. You'll see that this is a signal for heart attack, but it's the heart that's paining, and it's radiating through the body and letting you know, I'm hurting, I'm hurting, I'm hurting. What's the pain in my heart? What's the emotional burden in my heart? What's the stored stress in my heart that's creating all this pain, right? And usually the key emotions underneath them is anger, resentment, criticism, guilt, fear, big, heavy, negative emotions that we are not consciously, but subconsciously, they're stored in our heart, in our mind, in our body, right? So you want to address those unrelated issues or seemingly unrelated issues to get to the, you know, core of the shoulder pain or whatever pain you may be having at this time. And so what's the one-stop shop or one-stop tool for any kind of pain you're having? Now, there is no one-stop treatment. There's no one-stop diagnosis of chronic pain, right? Because you've been to a doctor and you've seen that they prescribe medicines, and then they say, I don't know, it worked for this patient. I had a client who was a doctor, and she said, you know, I knew there was this whole thing about mind over matter is true, because I would diagnose the same medications for the same exact symptoms, and one heals and one doesn't heal, right? So there is no one exact like treatment or, you know, one exact way to diagnose your specific chronic illness, but there is one-stop tool to manage your chronic pain, right? And that one-stop tool, of course, you know it already, is EFT, Emotional Freedom Techniques. It's called tapping, right? And basically tapping is like acupuncture, but instead of sticking needles all over your body and triggering an electrical current to stimulate the energy endpoints in your body, EFT or Emotional Freedom Techniques is, you know, you can use just your fingertips to stimulate endpoints of or acupressure points in your body while you tune in to what's going on, what's stressing me emotionally, what's stressing me mentally, what's stressing me spiritually, right? When you feel completely disconnected with life, with that's a spiritual pain, isn't it? So when you tune into what's going on with me, inside of me, and then you tap on these key acupressure points on your body, just like I'm showing you. And to know more, you can go to my YouTube channel, EFT with Shalini. So you go to YouTube and just put in EFT with Shalini, and you'll get over 100 videos. And many of them are tapping videos. and you start tapping on these key acupressure points, and you will experience instant reductions in your pain levels, right? So you can manage your pain levels instantly. But if you've got chronic pain, it's a complex, multi-layered problem, right? So it's a bit of an art to get to the root cause, and still you can use the same tool and the same points over and over again, no matter what pain you have. But it's just it's a chronic, and you have to, you know, it's a tricky way to get to the root. So you can manage your pain instantly right now if you want. If you're in chronic pain, I've put a link above, so give it a go, give it a try. It's the link is above, so if you just click it, you'll get a video on how to use it for tapping your pain away. But if you are, you know, suffering from chronic pain and you want further support and you want further help, you can always email me, Shalini at EFTthailand.com. And also, you know, I have a workshop coming up, which is, you know, all about chronic pain. It's a workshop on chronic pain. So if you are interested, it doesn't matter if you're living in Bangkok or not, just let me know. Just write interested below, and I will send you the details for that workshop. And you know, it's all about chronic pain and understanding your body signals and lots of good stuff. So if you're interested in learning and you know, applying this tool EFT for helping you with your chronic pain, just comment below and say interested in workshop, or just write interested, and I will send the details to you. So thank you so much for joining. I hope this was helpful. I can just go on and on and on about this topic because I've worked with it for so long. And you know, my intention is to create as much awareness about this so that people are living pain-free, and they have this amazing, easy tool at their fingertips. My kids have been using it since they were 5 and 6 years of age. If they can use it, you can use it. It's not complicated. Please give it a go. And I look forward to seeing you in my next Facebook Live. Thanks, guys.